No one wants a suit that's too big or too small. You want one that fits you well. It's the same with knee implants. Studies show that traditional knee replacements can leave up to 30% of the people who receive them unhappy with both pain relief and function, due partly to poor implant fit, alignment, and bone coverage. Traditional knee replacement commonly leaves patients with ongoing pain from clinically significant overhang, where part of the implant digs into the flesh. restor3D offers 2 personalized options for a great fit: full personalization or our made-to-measure imprint system. In a clinical comparison study, people with a restor3D implant in one knee and a different implant brand in the other knee reported they preferred restor3D by a factor of more than 10 to 1. And 90% of the restor3D patients in another study reported being satisfied with their outcome because of how we applied their data to ensure a superior fit and to restore their natural range of motion. With both restor3D systems, we use a CT scan of your anatomy to design preoperative plans just for you. And we also 3D print personalized surgical instruments to help guide your surgeon. Your implant and instruments are then pre-sterilized, packaged, and shipped safely to your surgeon using our surgery-in-a-box delivery method. And best of all, you can choose your level of personalization. Our fully personalized system is made individually for your unique anatomy. Our other fantastic option is our made-to-measure imprint system with excellent alignment and bone coverage based on our massive database of previous patients' anatomy and implants. Advanced software analyzes your CT scan and picks the best imprint size for you. Imprint includes personalized features designed to provide a better fit and alignment than generic off-the-shelf implants. restor3D, offering you the choice between 2 data-driven personalized knee systems to achieve proper alignment and a great fit. Visit us at restor3d.com to learn more.